The COVID-19 pandemic has been a devastating health crisis for all of us. But one component that we often overlook is how is the pandemic affecting our mental health? Between the job layoffs and the furloughs, and the housing instability, and the food insecurity, and the social isolation, and all the socio-political conversations we're constantly being engaged in, all of that can take a really big toll on our mental health. So just like you're washing your hands and wearing your masks to take care of your physical bodies, there are steps that we can do to take care of our minds as well. Now, I know what a lot of you are thinking. Therapy is just too expensive. However, did you know that every Colorado state regulated plan and Medicaid all cover a wide variety of mental health and substance use services? Colorado has been making some really great strides in trying to make sure that behavioral health care is treated the same as physical health care by insurance companies, a concept that we refer to as parity. So some of these policies that you may be familiar with are the Affordable Care Act, the Mental Health Parity and Addiction Equity Act, and the recent 2019 Parity Act, all of which make sure that those who are enrolled in Medicaid and in state-regulated plans have the same rights to receiving therapy for your depression as you do for receiving, let's say, a heart disease evaluation. And all of these parity provisions also apply to telehealth services. And so you should have the same ease in getting a Zoom session with your counselor as you do with, let's say, your primary care provider. So the barriers that we're referring to, so no greater barriers for mental health as there are for physical health, those include things like providers in your network, how many visits are covered, how much money are you expected to pay out of pocket, and what are the pre-authorization requirements. Now, if you do find that any of these barriers exist for your mental health services that don't apply to your other medical services, then you may be experiencing what we like to call a parity violation. And a parity violation is a violation of your rights. Now, if you do think that you are witnessing a potential violation, then you should call the Division of Insurance. Not only do they have the right resources to resolve your particular issue, but your issue may be something that many other people are experiencing. So you alerting them of your situation might help save other people's lives. So it's essential to make sure that your voice is heard. Another great resource is the state's Behavioral Health Ombudsman's Office, which serves as a neutral entity to address barriers to access to behavioral health services for both consumers like yourself, as well as behavioral health providers. Now, if you have any questions on whether or not your specific situation is considered a violation, please refer to our document titled the Red Flags document to see whether or not your situation may be a potential violation. Make sure that you are taking care of yourself, both body and mind. These are really anxious times, so do everything you can to make sure that your services are intact. Thank you.